16 medical specialists from the United States have arrived in the Gambia to provide free surgical and medical care for children in a partnership between Children's Surgery International and the Edward Francis Moore Teaching Hospital. The team, comprising surgeons, anesthesiologists, nurses, among others, will be in the country from November 13 to 23rd, delivering medical treatment, conducting training, and donating essential equipment. On Sunday, the team conducted a pediatric surgical screening day at the Edward Francis Moore Teaching Hospital in Banjul. The activity was coordinated by the Gambian Embassy in Washington, D.C. in collaboration with Impact Health, the Gambia. Children's Surgery International provides free pediatric surgical services and professional medical training to undeserved communities around the world. In a related development, Impact Health, the Gambia, donated a consignment of medical equipment and vital supplies to Edward Francis Moore Teaching Hospital, Bundung Maternal and Child Health Hospital, and the Kanifing General Hospital. The presentation ceremony took place on Sunday at the Edward Francis Moore Teaching Hospital. The donation, sourced through Impact Health's network of US-based donors and partner institutions, included vital sign monitors, computer monitors, drills, and other essential items aimed at strengthening service delivery in the beneficiary hospitals. Speaking at the event, Abdul Wahab Manjang, founder of Impact Health, the Gambia, underscored the importance of both the donation and the free pediatric surgical mission, noting that such interventions play a crucial role in advancing healthcare delivery in the country. He urged hospital authorities to make effective use of the equipment to improve patient outcomes.
Utilize these resources that have been given to the hospital out of a goodwill to support the delivery services of patients. Basically, have those tangible results. For example, we have donated 20 vital signs monitors. These monitors basically look at the patient's, blood pressure, oxygen, heart rate, to help the clinicians to assess and take action in a timely manner. So we expect these equipment to be utilized at their best, but also, keep them maintain them, because it's all about maintenance. You can have thousands of equipment, but if you don't put maintenance into it, you basically, driving it out of its purpose. So that's what I will say, because our donors really find these supplies that we donated, are essential to support our care delivers in this country, and they are donated to us by Mega Foundation Solutions and MATA. These are organizations that have goodwill for this country, and part of that donation process, we did some fundraising back in, I think it was in July or August. We raised over $10,000. A majority of that funding came from the Gambian community in Minnesota. I would say 80% of it. So we were able to, transport those supplies to this country, and now they are all, being distributed to their respective destinations. So this is great. I'm happy for it.
Mr. Manjang further called for stronger collaboration between the Gambian health sector and the international partners to accelerate progress and address persistent gaps in the system.
Let's work together. It's about collective work, especially when you have Gambians traveling from overseas to come and support the health system, because we've been through it. I am a victim, or I have lived experience with lack of resources. I was once bitten by a dog, and I couldn't get a rabies shot in the whole entire country. Not Edward Francis, not Polyclinic, not Kololi Clinic, not Lamtoro, MRC. I went to all these places, and it was frightening. As a fifth grader, you sat with a doctor right in this building here, looking at your face and telling you, without a rabies shot, you got 10 days to live. 10 days to live. A fifth grader. I spent that 10 days, that was the worst in my life, counting each day, when will be my last day, instead of being at the soccer field on the street, playing soccer, or at Bakote football field, playing football. But I was thinking how many days I have left. So our organization founding is rooted in that life or that lived experience. So I will say anyone with a skill set that you think is valuable to support the health system here, please come and join. It's about working together. It's about helping each other because we have loved ones here.
Also speaking at the event, Todd from Children's Surgery International highlighted the organization's decade-long commitment to supporting children worldwide. He affirmed that the mission not only aims to treat children in need, but also to build local medical capacity by training Gambian doctors in specialized surgical procedures.
So a big part of the mission that we have is not only to do the procedures ourselves, but to help train the local physicians to do similar procedures. So the model is that we would come and we would do procedures together for a period of time, and then after a while, perhaps you don't need us anymore. I think we're making great progress. We're learning. This is our second time in the Gambia. And so we want to make it go as smoothly as we can, and there's some things we can do there, but we've got a great list of patients that we can help, and we're really eager to get started tomorrow.
Dr. Chorna S. Jallo, consultant pediatric surgeon and deputy chief medical director at the Edward Francis Moore Teaching Hospital, expressed gratitude to CSI and Impact Health the Gambia for their continued support to the country's health sector. He commended the partnership for improving access to specialized pediatric care and strengthening hospital resources.
Then the other advantage is that when they come, then we have exchange of ideas with them, and then we have discussions. And then we also have sharing knowledge. So all these things enrich our training. So also another thing is, together we look at our data, and it also helps us to tweak what we do. So it also augments our research, and then looking at the practice and other things. So in addition to that, when they are coming, they come with consumables, they come with materials. So all of this help to augment or to complement the things we have. Because as you know, as a low-income country, whatever we have will never be enough. Government is doing their bit. Our other partners are doing their bit. So when they come on board with consumables, with materials, that also complement some of the things. So in a nutshell, all of these activities help to enrich, to complement, to help us, collaborate from that angle. So in that, our training becomes something that sort of like one would say is acceptable.
Impact Health the Gambia is a registered non-profit organization with tax-exempt status in the United States. Its core mission includes providing essential medical equipment to public hospitals in the Gambia, supporting healthcare system improvements, and facilitating training in mental health and addiction services. Reporting for Kirfatu, I am Fatu Silla.